Welcome back to BrightBoundX. In part 1, we uncovered the forgotten history of your jaw, how modern diets, soft foods, and the comforts of civilization shrank our faces and threw our teeth into chaos. But today, we go one step further. We ask, can we fix it? Can we prevent the next generation from needing braces, surgery, and metal in their mouths? The answer might surprise you. The orthodontic battlefield. Walk into any modern orthodontic clinic and you'll see the same tools of war: braces, retainers, expanders, headgear. These are the modern weapons used to fight the side effects of evolution, or rather, the side effects of modern convenience. And they're everywhere. Globally, the orthodontics industry is worth billions. In the US alone, over 4 million children wear braces at any given time. Some even start as early as 7 years old, before all their adult teeth have come in. So, is it working? The short answer is yes. Braces can effectively straighten teeth. Expanders can widen dental arches. Jaw surgeries can realign the bite. But here's the catch. We're treating the symptoms, not the cause. We're not fixing the evolutionary mismatch between teeth and jaw, we're just trying to contain it. Can we prevent crooked teeth? Now let's ask the bigger question. Can crooked teeth be prevented in the first place? According to a growing body of research, yes. And the key might lie not in metal wires, but in childhood habits. Let's start with chewing. Chewing is a forgotten force of facial development. When a baby or toddler eats soft, pureed food exclusively, their jaw doesn't get the stimulation it needs to grow wide and strong. But when children chew tough, fibrous foods, think raw vegetables, meats, nuts, their bones respond. The jaw expands to accommodate the pressure. The dental arch widens. There's more room for teeth to erupt properly. In fact, some orthodontists now recommend something called chewing training in young children, encouraging them to chew harder foods during key growth periods. The goal: to stimulate natural jaw development early and reduce the need for braces later. The mouth breathing problem. Surprisingly, chewing isn't the only environmental factor at play. Another major villain in the story of facial development is mouth breathing. Yes, really. Breathing through the mouth instead of the nose, especially during sleep, has been linked to changes in jaw shape, poor tongue posture, and even facial asymmetry. Here's how it works. When we breathe through our noses, the tongue rests against the roof of the mouth. This creates upward pressure, encouraging the palate, the upper jaw, to grow wide and flat. But when we breathe through our mouths, the tongue drops, no longer supporting the upper jaw. This allows the palate to collapse inward and upward, resulting in a narrower dental arch, less room for teeth, and a higher risk of crowding. Chronic mouth breathing is often caused by things like allergies, enlarged tonsils, or nasal obstructions. Left unaddressed in children, it can literally shape their faces, and not in a good way. The rise of myofunctional therapy. To tackle these subtle but powerful forces, a new branch of treatment is emerging: myofunctional therapy. This approach focuses on the muscles of the face, tongue, and jaw, training them to function properly through exercises and postural correction. Think of it like physical therapy, but for your mouth. Practitioners work with children and sometimes adults to teach correct tongue posture, encourage nasal breathing, improve chewing habits, and strengthen jaw muscles. The idea is to guide proper development, not force it through mechanical means. In some cases, myofunctional therapy has reduced or eliminated the need for braces entirely by ensuring that the mouth develops correctly from the start. It's not a silver bullet, but it's a promising tool in a more natural, preventative approach to oral health. What about adults? Can we still change our jaws? By now, you might be wondering, what about me? I'm not a growing child. My jaw is set. My teeth are already crowded. Is it too late? Not necessarily. While it's true that bones harden with age, the jaw remains surprisingly malleable throughout life. That's why adults can still get braces, expanders, or even surgical interventions with good results. More interestingly, there's a fringe but growing movement that suggests adults can remodel their jaws through posture, pressure, and consistent practice. The most well-known example, mewing, popularized by Dr. John Mew and his son Dr. Mike Mew. Mewing is a controversial technique involving proper tongue posture, nasal breathing, and light facial exercises. Its claims are bold, that consistent practice over months or years can reshape facial structure, widen the jaw, and improve alignment. The scientific jury is still out, and many dentists remain skeptical. But anecdotal reports and before-after photos have sparked a huge online following and serious curiosity. Whether it's pseudoscience or cutting-edge discovery remains to be seen. Rethinking wisdom teeth. Let's return to one last player in this story, wisdom teeth. For decades, dentists have recommended routine removal of these molars, especially in teens and young adults. The reasoning is simple. If there's no space, they'll cause problems. But not everyone agrees. Some experts argue that many wisdom teeth could safely remain in place if jaws were wider. Others suggest that removing them preemptively, without symptoms, may be unnecessary or even harmful. The conversation is shifting. A growing number of dentists now evaluate on a case-by-case basis, watching to see if the teeth are impacted or misaligned before recommending surgery. And some believe that better childhood habits could create enough space for wisdom teeth to erupt naturally. It's yet another reason why jaw development early in life may hold the key to healthier mouths down the line. The bigger picture, health beyond the teeth. Here's the fascinating part. Crooked teeth may just be the most visible sign of a larger issue. Narrow jaws, recessed chins, facial asymmetry, mouth breathing, sleep apnea, these aren't just cosmetic concerns. They're linked to deeper problems. Poor sleep, breathing difficulties, speech disorders, TMJ pain, even behavioral issues in kids. Orthodontics may fix the smile, but the roots run deeper. The structure of your face and how it developed can shape your overall health, which is why a growing number of doctors, dentists, and researchers are calling for a new approach. One that treats the mouth as part of the body, not a separate system. One that emphasizes prevention over correction. And one that sees crooked teeth not as a defect, but as a clue. What can you do? If you're a parent, here's what the science suggests. Encourage tough foods early. Think carrots, apples, meats, crusty bread, not just soft, mashed meals. Promote nasal breathing. Check for signs of mouth breathing in sleep. Teach proper tongue posture. Tongue to the roof of the mouth, lips sealed, breathing through the nose. Limit pacifier use after infancy. Prolonged use can affect jaw development. Get regular checkups with pediatric dentists and orthodontists who focus on growth guidance, not just braces. And if you're an adult, it's never too late to improve your breathing habits, practice better posture, explore orthodontic options if needed. Focus on long-term oral health, not just cosmetic fixes. You might not reverse evolution, but you can certainly stop it from doing more damage. Closing thoughts. What your mouth tells you. Here's what's wild. Your mouth is a fossil. It carries the story of your ancestors, your habits, and your environment. Crooked teeth aren't random. They're a result of modern life, of softness, convenience, and disuse. But they also remind us that biology is not destiny. What we eat, how we breathe, how we raise our children, all of it matters. The face of the future isn't set in stone. It's still growing. And with awareness, science, and a little bit of chewing, maybe we can shape it better. Thanks for watching BrightBoundX. If you learned something new today, don't forget to like, share, and subscribe for more stories that make you look at the world and yourself differently. Until next time, keep asking, keep wondering, and maybe try chewing a little harder.